Good morning. This is Dr. Antonio coming from Still Point Ayurveda live Monday morning. And today's going to be on cravings. And specifically cravings that pertain to food and even beverage. I'm not going to discuss today mental cravings for external stimulation for whatever things that might cause you to crave them. Um, this is more particular to diet and general lifestyle considerations. And so, with regard to cravings, that's an indicator. First and foremost, if we have this sense that we're needing something, it's usually because of several factors, actually. The first factor is the diet, the menu that you had just previously ingested, or at least a series of foods in general, depending on your diet. You're lacking in something. And so when the body is craving something, are you clear what the craving is? Is it coming from this sense of, I wasn't satisfied in my last meal or series of meals, or I'm not satisfied with my overall diet that that you know supports my daily practices? And these are things that you have to look at and evaluate. You have to understand what comes into a diet, what comes into any given plate that you're eating. Are you getting enough carbs? Are you getting enough vegetables? Are you getting enough oils? Are you getting enough grains? Are you getting enough protein? We have to evaluate this for ourselves individually to determine what our constitution is, what season it is, what time of day it is. And it's like a Rubik's Cube, as I tell many of my patients when we're trying to align with the sense of health and well being that's individualized. It's finding the right combination that rotates through time and space because the appetite will change through each season. The appetite will change through each time, each part of the day. And so it's important to really consider this. And if you say, well, my diet seems to be pretty substantial, then and you can honestly look at your diet and say, like, yes, I have enough protein, I have enough carbs, I have enough vegetables, I have enough fats. Then you would have to wonder, what's my quality of sleep? Because as I've talked about this before, around the importance of sleep and sleeping around 10 o'clock and waking up whatever time that you wake up that's appropriately, anytime at 4, 5, or 6, depending on the time you fall asleep. If the sleep is not proper, then this is going to offset the digestive system, it's going to offset the body. So it's not uncommon that after poor night's rest, the next day there's an increased inclination towards caffeinated beverages, foods that are going to be energizing, beverages are going to be energizing, coffee or power drinks or chocolate or anything that's going to be sweet to kind of support increasing that energy externally that the body is lacking internally because it didn't properly metabolize the previous day's intake of food, which is what happens at nighttime. When we fall asleep properly, which is by 10 o'clock, and definitely review the other talks that I've done on sleep, then the body can break down exactly the way it needs to, what it needs, and put everything in its organized way where it needs to belong. And then the next day we start a new day, a new chapter. We spit up in the morning to clear up our throats, and might be some mucus in the nose that we clean out, and then we poop, and then we pee, and then we start the day, letting go of yesterday, letting go of the past. And incidentally, we can equate pooping as to letting go of what was previous to this moment. So, food for thought. And so, anyway, if the sleep is not proper, then there's a very strong chance of cravings the following day because the body is looking for adequate fuel and energy, basically. And the body will, communicate with itself within its organ system and the brain, especially if glucose is low in the brain will send the signal through hormones into the body, as part of the body, say, hey, I need some glucose, and the liver is responsible for this. And if the liver is not doing its job at nighttime, then we're compromising the liver, putting more stress on it. And so we look at sleep. So those are two pieces of what can contribute towards cravings. Then there's the general sense that if you're very busy mentally and the body is needing a higher level of glucose to sustain itself, like I remember in college that when I was studying in undergrad, I would bring combos and Snapple, raspberry Snapple, and a piece of Rice Krispies treat, and eat and drink all that while I was studying because my mind was very active, and that's what I was needing to support. Like, it was a sense of cravings, even though I know I had an adequate lunch. I was still needing something to support the energy, and there's some sort of component, like as we're eating and studying or reading and taking in information, that there's this increase of wanting to take something, which presents itself like a craving, which leads to the fourth component being simply emotional. The diet could be sustained, the sleep could be sustained, you're regulating your mental capacity for ingesting information, but then there's the emotional component where we're stressed, we're anxious, sometimes angry. Really depends on each person's mental constitution and individualized physical constitution that determines what you're going to do in that moment. So if you're angry, you might not want to eat, and if you are angry, you might be the person that does eat. If you're anxious, you might be the person that eats a lot or eats none. It really depends on your own physiological, psychological makeup, and so that also translates into expressing cravings. And so any one of my patients, whenever they say they're having cravings, I go through this series of categorizing and seeing which category might be off and trying to realign with things so that cravings can reduce. Um, and as a side note, if a person is having some grief that they're processing and they're craving something that's going to be an emotional comfort food, that doesn't necessarily mean that there's anything wrong, because in that moment, considering the circumstance, that might be actually an emotional requirement. It's just being careful of not to overindulge, or go into excess, which can cause plenty of other issues. It's a fine balance, especially when you're in the process of grieving, what you're going to do in supporting that and really being present with it and being gentle with yourself at the same time without sacrificing the health of the body. So these are things to consider. And, this is a general topic. There are specific conditions, like any kind of autoconsumptive condition, tuberculosis or types of cancers or diabetes or having AIDS or something that's going to be very drastically challenging the body and requiring a high input of information because the tissues themselves are falling apart and not being nourished from the inside to whatever capacity. And that can also cause cravings, but that's a whole different level of discussion, which is beyond the scope of this discussion this morning. So I just wanted to throw this out there for you to consider in your day-to-day lifestyle. If you're having cravings, where are they coming from? What are they about? And this helps you to really consider yourself, to self-reflect. And in Ayurveda, this is what we are doing, is achieving a certain level of consciousness and understanding cause and effect, and it's understanding our role day to day as part of nature. So I'll leave you with that to ponder, to think about, to digest. And as always, I'm open to working with new patients. Feel free to private message me. I also do yoga class twice a week on Zoom, Tuesdays and Friday mornings Eastern Time, with the Ayurvedic integrated approach as a type of Hatha Vinyasa style. And I look forward to hearing from you. Have a great day, and talk to you soon.